Welcome to Module 2, Patient Eligibility. There is not a more important step in the patient's benefits and claims process than eligibility. Everything in healthcare as relates to services being rendered starts with eligibility. If a patient does not have eligibility, they will have to pay out of pocket. A lot of times, a practice's front office staff is negligent in getting the correct eligibility, and by the time the biller gets the claim to be processed, the services were already rendered. Therefore, the claim will deny, and the biller will have to submit an appeal, and we don't want to have to do that. In our experience, we find that a lot of issues for claim denials is a result of eligibility and benefits not being verified and input into the EHR system correctly. A simple call to the patient's insurance company or a simple search in the EHR system to verify eligibility will save your client lots of money. This lack of accuracy is one of the top reasons a practice fails. It is the front office staff's responsibility to verify eligibility with the correct payer before services are rendered. As a medical biller, once you've received the claim to be processed, you should also check for eligibility because you need to see what the patient's copay is and what their deductible is so that you can know how to submit the claim. If a staff member of a practice lists the patient as eligible and the patient has services rendered, the claim is then submitted and it comes back rejected due to the patient not being eligible. The claim will likely not get paid at all, and while there is an option to appeal, in most cases, the appeals department of the insurance company will deny it, stating that the patient was not eligible on the date of service. These claims are hard to get approved, even through appeals, because the insurance companies don't want to pay anything that was processed incorrectly purely out of neglect, because, of course, that saves them money. They have an entire appeals unit that determine whether the claims can be paid or not. If the appeal is denied, there is nothing you can do, and it will result in a negative deduction on the provider's account. So, what is the process of eligibility? The process of eligibility consists of the following: obtaining the patient's insurance ID number or insurance card. It is recommended to make a copy of the card, but some front desk staff will store the card into an EHR system, and that's also fine. Call their insurance company or use the EHR system to verify the patient's eligibility by checking for effective date, ID number, copay, deductible, group number, and claims address. Always ask if authorization is required for the services the patient would like to receive. For anything other than an office visit, you should always ask if there's an authorization. You can also look on the website or via the EHR. When you see their benefits pop up, look for the services they're receiving to see if they require authorization. If so, you will have the referral coordinator for the practice you work for submit that authorization to their insurance company. Once that's approved, the patient can be seen for that service, and then you can bill for it. You will also need to ask who the patient's PCP, primary care provider, is and what kind of plan the patients have. Is it an HMO, PPO, or fee-for-service? Always ask the payer if they see another insurance company on file. Sometimes the patient will only present one ID card when they have two insurance policies. This happens a lot, so you always ask if they see it because with the coordination of benefits, the insurance company can usually see any other payers. Ask who the subscriber of the policy is. The subscriber is the person who owns the policy, whether he or she has coverage through their job or self-employment, and then they cover their spouse or children. With Medicaid plans, always ask because Medicaid plans list the child and parents separately, so you need to verify because when you file the claim, it will ask who the policyholder is. So let's look at an example of patient eligibility. Jack has been employed by the California Farmers Market for 30 years and retired on 3/15/19 with conditional full benefits. The company policy is that all retirees must switch to the company's retiree medical insurance plan with ABC Healthcare. The transition will take 14 days, and no healthcare coverage will be provided during the transitional period. Jack broke his ankle on a skiing trip on 3/21/19 and was rushed to the local hospital. On arrival, he presented his insurance card reflecting the California Farmers Market Active Employee Plan. When the admissions representative of the hospital verified eligibility, it was declined. Why? Jack went to the hospital before the 14-day transitional period was over and therefore had no active insurance. Jack is now responsible for the entire bill. This is why it is so important to verify eligibility, both as a patient and as a practice. I always recommend to those who get a job as a biller to make it very clear that you want to focus only on billing and not work the front desk, because it is a distraction from getting your claims processed, and you can't make as much money for the practice as you could focusing on billing alone. It really does take away from the time you need to give to the billing process. So that concludes Patient Eligibility, Module 2. Please complete the patient eligibility quiz to check your understanding before moving on to Module 3.